Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
To nursing salaries, is negotiation actually possible? I'm Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. Now, I would ask, have you ever, but I really think all of us have had second thoughts about our salary offers. Usually we're led to believe that bands are bands and there's not any wiggle room on the base pay at all. So today we're going to start asking some questions. Where do managers actually have discretion? Which levers get greenlit the fastest? And APRNs, we're going to talk about that too. Where do APRN contracts hide value, call, and CMEs? Here with me is Dr. Vanessa Pomarico, who is going to help us understand our pay a bit more and find some ways that we can wiggle the number on the paper closer to our value. So grab your coffee, paper, and your pencil, and let's figure out how we can turn the I don't think we cans into here are a few options we can say yes to. Vanessa, thank you for joining me.
Well, thank you so much. I'm so excited to be here. It's one of my favorite topics to talk about. I love to empower nurses and nurse practitioners to really get the best salary that they can.
I was in leadership for a little while and in a hospital. And I will say that even now for me, I still feel like the veil has not been pulled away. I still don't understand how salaries are determined as far as in your facility and what things you could move around, because I felt like it was just really hidden down in HR.
That's so true. And as nurses and as nurse practitioners, we never were really taught how to negotiate or that it was even an option.
Mm-hmm.
And many times, especially as nurses, and I remember when I was a nurse, I walked into HR, the nurse recruiter said, here's 7 positions. Which one would you like? This is the pay. This is when you start. And that was it. There was no discussion about, is there any wiggle room? Do I get any extra compensation because I bring a different experience to the table? And as nurses, I think especially, they are less likely to negotiate for any of the salaries or any of the benefit packages, because again, it's just pretty much giving you a platter to say, this is what it is, take it or leave it. And we really need to change the conversation about that.
I have always felt the same way whenever I walk into a facility. And I actually applied for just a PRN position not that long ago. Just wanted to try it out at this facility. And they didn't even talk to me. They just sent me a note, said I asked for too much. They're like, but you couldn't even talk to me about pay or anything. They just decided that I was asking too much, so I wasn't worth the time. And that's very disheartening too, because where's the value in that? You're letting some great people go.
And it is so true, because they don't even realize what nurses and nurse practitioners can bring to the table and what they can bring to their respective practice settings. And in many institutions, the salaries are pretty much set. But like you said, there's always some hidden value that people can have a little bit of wiggle room. And if you don't ask for it, you're not going to get it. Because let's face it, the bottom line is what their bottom line is going to be. How are they going to be able to hire somebody of value or somebody of quality, but yet maintain a certain budget that they can work with? And I remember when I was working in the hospital, the nurse manager was getting bonuses when she was saving money on, let's say, our annual evaluations and getting the raises that we deserved. But the less money we made, the more money she made, because she was saving the hospital so much more money. And that's really what I said, I really need to, that was an eye-opener. And I said, I really need to get it out that we have to be able to advocate for ourselves. Nobody else is going to do it for us.
Yes. Oh, and that just seems like such a conflict of interest too, because you're more to not pay your staff, and especially what they deserve, because you think you deserve the money. I just don't understand that logic as a leader.
It happens more than you know. And I give these presentations across the country, and I hear it all the time from nurses and nurse practitioners that they've been told that things that factor into a salary would be like, cost of living or the location,
Mm-hmm.
your
Mm-hmm.
experience, what your educational level is. And those are
Mm-hmm.
the different things that we really need to make sure that we're bringing that to the table. So, for example, an associate degree nurse is going to make less money than a BSN or an MSN
In theory.
in theory. And I do remember I started as an ADN. I was
Mm-hmm.
an associate degree nurse. And that was at the time when the hospitals were, hiring ADNs. And I had
Mm-hmm.
literally graduated in May and I was enrolled in a BSN program right in that
Mm-hmm.
September. So I really was going to school straight through, but I wanted to start working. And I remember that when I got my bachelor's degree, all of a sudden, and I was hired with 6 other ADNs. Now that I had a bachelor's degree, now suddenly I was making more money. And
Mm-hmm.
when I got a master's degree, then it was another step up. Well, you're making more money, you can make more money as a master's because you can do X, Y, and Z on the unit. And you're bringing
Mm-hmm.
something to the table. But again, I wouldn't have known other than the fact that they were going for magnet status. And
Mm-hmm.
magnet status states that they want their nurses to be BSN. So that was an incentive for them. That's not the case anymore. So we have to make sure that, again, that we're advocating to say, even if it's on our resume or on our CV, this is what I'm bringing
Right.
to the table, and make sure that it's clear. I think a lot of times nurses and nurse practitioners don't represent themselves well enough on paper. So if it's
Yes.
on their CV, if it's not on their CV or their resume, then it doesn't
Mm-hmm.
get picked up by the electronic scanner, or the person interviewing you is really just looking for a body with a license. And they're
Mm-hmm.
not really looking to say, well, Candace is a certified diabetes educator, or Vanessa is a wound care specialist, or,
Right.
that we've gotten some type of specialized training that's going to be of benefit to that particular, unit or institution.
Right. Now, let's take a step back and let's talk about how compensation really works. What is that determining factors for, a staff nurse's pay, the band, the step, the midpoint, the market rate? And who makes the decisions in the movement within these?
So those, interestingly enough, are all with the bean counters at the respective institutions. They're the ones that come up
Mhm.
with the budgets. And then it's up to the managers to decide, here's how much money I have to spend. And this is what we're going to be offering, a new grad or somebody with experience. And I think for the listeners that are not sure what it is, so a salary band is, when we refer to the band, it's a type of pay structure that groups of similar jobs have a specific range of pay, and it's defined by like a
Okay.
maximum or a minimum amount. So you'll go in, or you might even read in the job description, and it might say salary range, from A to B.
Right.
And so that's what the salary band is. And what this does is it helps organizations to help maintain really more of what we call a fair and consistent compensation, because they align the pay within the specific role. So, for example, for nursing, and it looks at specific qualifications, what your experience
Hmm.
is, but it also is measured against what we call external market rates. So, there are nurse practitioners and nurses that make a lot more money working within a hospital system than somebody who's working out in the community in, like, let's say, a private practice or an FQHC. So
Hmm.
really what the salary bands do is really to help provide a framework more for budgeting and more for the accounting piece of particular institutions.
So, how does pay transparency and the internal equity rules influence, say, what a manager can actually offer?
So, everything is about transparency these days. And pay transparency is really a type of practice. In some states, it's a law. And it
Hmm.
really requires respective institutions to be open about their compensation. And it includes things like sharing salary ranges, if there's any type of bonus structure that is available, and any other types of pay that current employees or any potential employees or future employees would be able to then capitalize on. But again, they are transparent about it. It doesn't mean if you ask for the highest level that you're going to get it. And I always say this to the new grads. If you see the salary range, you don't want to go in as a brand new grad and expect that you're going to get paid, let's say, $150,000 a year, when
Yeah.
if the person behind you is coming in that has experience, they're more likely
Right.
at the higher end of the salary range. Now, that doesn't mean that you have to accept the lower end. Again, the transparency has to do with the maximum and minimum. But it certainly means if they offer it to you, you can
Mhm.
then, is there any room for negotiation here? I always say, you don't pay sticker price on a car.
Mhm.
So why are we doing that with our salary? So you never want to
Right.
take first. Employers expect you to counter offer. So don't always feel like you have to just take the minimum amount.
And I never felt as a new grad that I could negotiate. But even the more experience that I had, I still didn't really feel like I could negotiate in those settings. It made it very black and white for me. Like, here you go. Here, just like you said, whenever you took your first job, you walk in, they're like, here's what your pay is, here's when you start, and here's the extra information that you need. And it never felt like we could negotiate. So I guess my question would be, I know we're seeing more and more hospitals where unions are coming in, nursing unions, working unions. So what truly is fixed, and what can we actually negotiate that's helpful?
So the unions or the collective bargaining agreements, they have a contract that they negotiate with an individual employer, and the
Hmm.
union is one that sets the terms between the employer and they set the terms of employment, and that includes compensation. Now, what the union does is it actually supports the particular future employee. But what they do is they establish the minimum salaries. They help to create wage scales. They have they and that they really do advocate for set schedules for pay increases. Where a lot of
Hmm.
other people, I hear from people all the time, they say I haven't had a raise in 7 or 8 years. But if they're a unionized
Right.
position, they automatically get that. Now, the flip of that is remember that when you're part of a collective bargaining agreement, you are paying union dues. And so those dues
Hmm.
are really to go toward paying the people that are going to fight for you and to help
Right.
set the terms of employment. But also, too, that's what gives them the leverage to then work with the individual institution. I will say
Hmm.
that unions are becoming a little bit more commonplace. I don't see a lot of them in the healthcare system,
Right.
especially I'm in New England, and we don't see it at all here in New England. There are few and far between where you really do see a lot of nurse practitioners, especially in a collective bargaining unit.
Right. I mean, it sounds in theory like it would be great having somebody that is fighting for you, but I'm sure that there are some negative sides to that story as well.
There really are. Now, I remember not too long ago, there was a collective bargaining unit at a particular hospital. I believe it was in the Midwest, but don't quote me on that. And they ended up going out on a strike. And it's a very individual and personalized um, role as to whether or not you're going to agree to go on strike. But when you are part of a collective
Right.
bargaining agreement or a collective bargaining unit, that's part of the thing that you agree to. And
Mhm.
here feel a little bit guilty saying, well, if I go on strike, who's going to take care of the patients? So
Right.
that's a real moral and ethical dilemma for a lot of people. But in this particular institution, everybody went out on strike. And the union was prepared to go out on strike, but unfortunately, the hospital was already 3 steps ahead of them and had all the
Mhm.
travel nurses coming in. And they had travel nurses, they had travel nurse practitioners, PAs, physicians, and they were ready to go. And
Yeah.
I don't remember what the outcome was, but I remember it went on for a very long time, and some people ended up having to leave and go find employment elsewhere. So there's two
Oh,
sides
wow.
to it. The
Yeah.
collective bargaining unions can really work well. They can
Mhm.
be advantageous, but they're not always in the end, it's not always the best thing, especially if the union says we're going to go out on strike. Now, having been part of a collective bargaining agreement, I will just tell you that the unions work very hard not to strike. And
Mhm.
everybody waits until the final hour, the nth hour, to come up with an agreement, or they'll go back to the table because let's face it, it's not just the unionized employees, it's the
Mhm.
hospital as well, because they know that it's going to set them back. Now, does that give you a little bit more leverage having a union. It all depends on how strong your union is and whether or not your
Right.
administration is stronger.
Right. Yes. That is definitely something to think about too, because and you got to read that fine print to see what else it is that you are responsible for. You have fees, but there's other responsibilities in that. So those are some really great points to think about before stepping into a unionized position. So
Exactly.
thank you for bringing that up. Now I want to move into what's negotiable. We always hear base pay, base pay. So I'm familiar, and I know most of us probably are familiar with what our base pay is. But beyond our base pay, it's curious to know what's negotiable. So if our base pay is technically firm, I mean, are there some levers that we can move realistically to, request to be able to get higher pay?
I always say that there's always money in the bank. They're just not telling you where it is. So, you
It's in
know,
some bank. I don't
yeah,
know which bank.
yes, there's money always there. And I always tell people that you always want to counter offer if the salary is not able to be negotiated. And when you don't counter offer, that sort of sends a little bit of a message to say you're an easy touch. So
Hmm.
that when you go for the following year, let's say you're a year later and now you want to go to them, and we're talking about non-union positions here, and you want to go to them and say, I've been here for a year. I'd like to talk about getting a raise. And
Right.
they already know that you accepted the first offer when you signed on with them. So they may,
Hmm.
play a little bit of hardball with you. But I always say
Hmm.
you have to counter offer if the salary is not able to be negotiated. And the question you always say is there any room for negotiation? That just opens up the discussion. And then you
Right.
can ask about whether or not sign on bonuses are available, whether or not there are supervisory positions like a charge nurse. Let's face it, charge nurses
Hmm.
get a little bit more of an hourly compensation for that. Is it a loan repayment site? Now, loan repayments happen to be great for people. You do have to sign on for at least 3 years, I believe. And it is a very rigorous type of application, and they're not always in the places where you are working currently. But it's always a
Right.
good idea to ask. You just never know. The other things that you can negotiate with is, let's say you're not a morning person, and Lord knows I've worked with a lot of enough people that were not morning
Don't
people.
talk to me until about 10 a.m., okay?
So I'm
I
going to
don't know if
speak
I can give you a complete sentence.
I'm going to speak your language right now. So let's say you're not the morning person and you're going to go in for an interview. You can just
Hmm.
say to them, have you ever considered doing off shifts, like coming in at 10 and working till 6? Now, it may not be feasible in the inpatient setting as a nurse to do like a 10 to 6 shift, but certainly an off hour shift goes a long way, especially in a hospital setting, because you're overlapping the regular shifts. We know the 7 to 7
Hmm.
shift is the usual shift now, but some hospitals and some institutions still have those 8 hour shifts. So let's say you're going to do an 11 to 11, or I know people that do 3 a.m. to 3 p.m. If you're
Yeah.
if you're that kind of person that you know that you can, either you don't mind getting up at the crack of dawn to go to work, or you need to have those 2 cups of coffee, and like you said, don't talk to me until it's at least 10 o'clock. Maybe you're
Yes.
that person in the outpatient setting. You say, I would like to work 10 to 6, 11 to 7. And that
Hmm.
gives your patients also the ability to come in after hours. And I have to tell you, I have done the 11 to 7 and 10 to 6 at least 2 nights a week since I became a nurse practitioner 27 years ago. And my afternoon after 4 o'clock appointments are always booked because patients don't want to take time off from work. So
Yeah.
it is, you are able to then, ask about those types of opportunities, because if you don't ask, you don't know if it's going to be available. Or the person
Hmm.
interviewing you may not think, oh, we haven't thought about
That's
that. That may work to
yeah.
our advantage because we have, we're short staffed, or we know that somebody has to leave on a particular time for whatever
Hmm.
reason. Having those off hours usually is a way to negotiate. Now, another thing would also be retention bonuses. And these are bonuses that a lot of people don't think to ask about. So let's say I've been working for this particular institution. I came as a new grad. I go to school to become a nurse practitioner. And now I'm thinking about, where am I going to go work? Well, it
Hmm.
behooves the hospital or the institution to hang on to those employees who have been there for a while, because they're familiar with the institution, they're familiar with the electronic health records now that we have that. And so a retention bonus would be something that they would offer to somebody like you or I if they
Hmm.
wanted to retain somebody like us because we're a known entity. Our work ethic is known. We have a long history with them, and they really
Hmm.
want to try to retain those good employees. But if you don't ask about a retention bonus, it's not going to be given to you. Also, relocation bonuses will sometimes happen. So, in this day and age, now that we have video capability, there's a lot of video
Yeah.
interviews happening. And let's say you decide you want to move to Connecticut and you want to come here and work. You can ask about a relocation bonus, and that would cover things like your moving costs. They might put you up in some of the housing that they have, temporary housing, until you
Hmm.
can find a place of your own. And so they'll give you some of those costs, some of that money up front to help you with your relocation. So those are just a couple of things that are negotiable beyond your base salary. And just remember that your base salary isn't the only thing that the employer looks at. So the bottom line, you will always think, or people would always think, I need to know how much money I'm going to take home at the end of the week. What
Right.
the employer's looking at is not just the base salary. They're looking at your compensation package. And that's always
Mhm.
more expensive. And that's the bottom line that they're looking at.
When they hear someone say levers, move levers in different directions to increase your pay, can you explain what that means?
So different levers. There's like variable pay levers. There's things like bonuses. They can have what they call spot awards or incentive adjustments, and those are things that incentivize people. So, for example, in pharmacy, there's a lot of pharmacies are very busy, but some
Hmm.
of the larger chain pharmacies will actually do like a spot award or an incentive bonus, and they'll say if we can fill 1,000 prescriptions today, the
Yeah.
pharmacist will get X number of dollars. If you want to do an extra shift this week, you'll get X number of dollars. So there's lots of incentive adjustments, and those are the ones that tend to get approved much more often because they're not something that they have to pay out on a regular basis. It's kind of like a little kitty that they have on the side. And those
Mhm.
variable pay levers are the kind of things that they can kind of go into this, let's say petty cash for lack of a better word, that they can say, well, I'm going to give Vanessa, 200 extra dollars because she stayed late today. So even though she got overtime, I'm going to give her a little bit of bonus money. Or let's say you had 3 sick calls and now you have to do a double. In addition to doing that double and getting that overtime, and let's face it, we all know that when you do overtime, by the time you get all your taxes taken out of your check, it's not overtime. And so the
Right.
employer has the ability then to kind of go to this little pot and say,
Yeah.
let's do an incentive bonus here. Now,
Yeah.
these types of things tend to go through HR a lot more quickly because the bottom line is that it doesn't increase an institution's long-term compensation costs.
Hmm. Now, I worked at a really small hospital when I was going through nursing school. And I remember that, of course, I worked as a monitor tech most of the time, and then I would work as a tech on the side sometimes. But if they really needed somebody, the house supervisor, they had a petty cash, is what they called it. And she would go to her office and she would be like, hey, if you come in for me on top of how much you get paid above, for overtime, I'll give you $100 cash right now.
Wow.
And of course, being a broke college student, you're like, sure, I'll be right in.
And a
Be
hundred
there in
dollars,
10 minutes.
a lot of money at that time. Yeah.
Yes, that's a lot of money for a broke college student. But I've never seen that happen anywhere in any of the bigger hospitals I've worked in, but just that one small hospital. And you could usually get people to come in when you were like, hey, I'll give you, it's Christmas time. Here's your extra $100. Go Christmas present shopping right here if you just come in.
So,
So
so I haven't heard about people getting cash. I think probably now they would be able to do that. But
I
they
know.
certainly can have these incentivized
Hmm.
awards. Awards is what they call
Hmm.
them. So
Hmm.
those are those variable pay levers that we talk about.
Now, what of the levers, which one do you see get approved the most? And why do they clear HR faster than say any base changes we ask for?
I think those incentive bonuses are the ones that they get cleared faster, only because again, it doesn't impact the institution's bottom line. There's no long-term compensation costs. It's not like they have to say,
Right.
we have to tack on an extra $250 to Vanessa's paycheck every week. It's a one and done kind
Right.
of incentivized bonus. And so that's why they put aside money knowing that they're going to have to dip into this fund. And if they don't dip into the fund, then it's money that they have back at the end of the year. But it's not something that's going to affect their bottom line because it's nothing that is
Right.
permanent and is going to cost them across the board. They don't have to have an extra line budget item.
Right. Now, I find this conversation, not our conversation, but just negotiation conversations when you're applying for a job, I find them very intimidating for some reason. And sometimes it's just you shut down because you're like, I don't know what I can ask for. I don't know. Or you get that question when you're filling out an application. It's like, how much money do you want? And I'm like, I don't know how much are you going to offer me? Um, but what questions should we actually ask to try to find some of that hidden value that we can maybe tack on to our base pay?
So it's a great question, and you're not alone. There's so many people that feel intimidated by the negotiation process. And
Yes.
it's not something that we've ever learned. Nobody
Mhm.
taught it to us. And you really have to make sure that you feel strongly about what you're bringing to the table. And the more confidence you have in what you can bring to a particular position, the less intimidating it becomes. So one of the things, they have like what they call a float premium. I don't know if you've ever heard of that, but I
Mhm.
know nurse practitioners within my healthcare system, and I work in the outpatient setting. So we actually have float PAs and float nurse practitioners. So if somebody goes out on medical leave, they'll get a float person to then cover them for however long they need to
Mhm.
have medical leave, whether for whatever reason they're going to be out. Let's say we have somebody who's out on medical leave and we have two people going on vacation. It's a busy internal medicine office. We need to have a float, but that float makes a lot more money than I do. And
Mhm.
if I'm the person that's going out on medical leave, that float then becomes part of my overhead expense because I have to cover that as part of my overhead
Right.
expense. So those are hidden expenses we need to think about. Let's say, so I work for again a large health system, and I work in a fixed office. But let's
Mhm.
say they needed me to go to a different office. So, but I would have to drive 30 to 40 miles to go to a particular office, and then maybe the next day I have to maybe drive to another state. You can actually
Mhm.
get stipends or compensation pay, not just for the wear and tear in your car, but also the fact that you have to leave for work early. They'll have to pay for you to spend the night in a hotel or perhaps an apartment if it's going to be, for a longer period of time. Those would be stipends they can look at. But I have to tell you, the biggest one that people don't think about is bilingual pay. Being bilingual is such a huge asset in healthcare, and I don't ever hear of anybody asking to be compensated for that. And they shouldn't be
Right.
compensated. It is a huge skill. I don't speak Spanish. I understand a little bit of it. I'm able to
Mhm.
communicate a little bit with my patient, but not enough that makes me very comfortable. Now, we do have these little they're computers. It's basically like a computer on
Yeah.
a stick. And there's a whole bunch of them out there. And then they do American Sign Language, and they do a fair amount of well, they do a million other languages. But sometimes
Right.
it costs every time you use it. It happens to be, I'm very, very fortunate that my medical assistant is bilingual. She's actually trilingual, but she is,
Nice.
yes, it's very nice. She's actually fluent in several different dialects of Spanish, which is really wonderful. She also speaks Italian,
Yeah.
so it works really well. And whenever we have to do that, I always say, you need to be compensated for this. And then I go to the manager and say, this month I've used her 7 times to, translate for me, and she needs to be compensated for this. The other thing you
Yeah.
about too is just basically ask when and how are exemplary performances rewarded, because you
Mhm.
can't just necessarily think that they're going to automatically give you that raise at the end of the year. Many of them don't do that. And again, with healthcare being what it is, they're always counting the money. But
Right.
again, you always have to look at when they're going to be rewarded and what opportunities are available to help increase your compensation. Are there things like
Mhm.
a clinical ladder? So we have clinical ladders for nurses. I don't know if you have them for nurse practitioners in your particular institution, but we actually started a nurse practitioner
Mm.
clinical ladder, which is really wonderful.
Yeah.
And even our medical assistants have a clinical ladder. And when they get on that clinical ladder, that first time that they become an MA2, they get a
Yeah.
4% raise. You know,
That's nice.
might not seem like a lot, but at the end of the year, you're adding money on there. But it also
Yeah.
gives you a sense of pride. And I always tell them, if you get on the clinical ladder, it's because you've done something exemplary, but you have that
Uh-huh.
on your resume. Nobody's going to take that from you. And it's something to bring with you when you go to the next job.
Increases your value.
Absolutely. And another way to
Mm-hmm.
increase value is maybe doing a special project on a particular unit or within a practice. So, one of the things when I was doing my master's, that was when we had to do a thesis. I was doing the study for pain being the fifth vital sign. Now, we all do pain as the fifth vital sign now, but this was, back in the early
Yes.
1990s. And that was
Yes.
something that was just coming up. And so, I was doing this special project. Yes, it was because it was my thesis, but it was something that benefited the hospital. And when I was done, I actually did get compensated for having instituted the research that came out of, or
Mm-hmm.
institute the findings that came out of my research. And then another way that you can do that is bringing an additional certification that will bring value to a particular practice setting. So I always say that we have so many diabetics and not enough diabetes educators. And if
Right.
somebody has an interest in that, they should become a CDE. Or if they like wound care, and they get certified as a wound care specialist, then they
Mm-hmm.
should be able to get compensated for that. And so those are the questions you want to ask is, when are the exemplary performances rewarded? What other opportunities do you have? And is there any tuition reimbursement if I decide to go ahead and have a special certification done?
Yeah, and that's a great question because a lot of times they'll pay for you to go back to get your bachelor's, maybe your master's, but I don't know very many that I have worked at where they're like, "Oh, we'll pay for you to become certified." So that's a really great question.
And many of at least I know our institution, they do have some tuition reimbursement for people who are
Mhm.
getting special certifications, but that's not everywhere. But it happens to be that the institution that I've employed, they appreciate and value certifications. We are also a magnet
Yes.
status hospital, so it just increases the visibility as to why people should come to our institution as opposed to somebody else's. But one of the things I
Yeah.
wanted to remember before I forget is that you always want to ask when those salary reviews are scheduled and ask, is this automatic? Is it done on the
Mhm.
anniversary of my data hire? Is this done on a case by case basis? And if it's not automatic, I always tell people put a reminder in your phone a month before your hire date anniversary and start the conversation. Can we meet on such and such a date so we can talk about a salary review? And then bring
Yeah.
your data with you. You
Yes,
have
bring your value.
Yes, you have to bring your value with you and you can't
Yes.
wait until the end of the year. I tell people, everybody has notebooks and I say even if you have a running list on your computer, keep track of it. It's just like updating your CV. You can't wait until you're going for a job to remember, oh, did I give a lecture a year ago? What did I do?
Yeah.
You have to
Yeah.
update it regularly and you can't argue with data. They have to bring the
Mhm.
data with them. And so that this way you go into your review and you can say, here's everything that I've done in the past year or the past 6 months, and then make your case that way.
Yes. Yes. All right. I want to move into some negotiation tactics. And I want to talk about the BATNA, the best alternative to a negotiated agreement. So my
Yep.
question is, how should nurses define and use their BATNA without, burning bridges?
So BATNA is your plan B. Your plan
Hmm.
B, you always have to have a plan B when you go into negotiations because you need to know what to do if your first offer is declined. You've got to have that plan B. And what that plan B does is it provides you with that confidence, but also some leverage, knowing that this alternative is going to help you negotiate for better terms, but it also gives you the power to walk away if what they come back with is not satisfactory to what you want. And it's okay.
Right.
I tell people all the time, it's okay not to come to an agreement. There's going to be other jobs out there, and you have to decide if it's something that is worth sticking with, or if it's time to say, we just can't come to an agreement. Thank you for your time. Have a good day.
Right.
And then you leave. You
Right.
always have to have that plan B. You need to give the employer something that you're ready to give up in
Mhm.
exchange for something that you really want. That's really what the bottom line is.
Now, what is a BATNA? I mean, I know I defined it, but what is it?
So again, it's all about being able to negotiate that contract. And so there's different rules of negotiation. There's different models of negotiation, but what you need to think about is, your communication, keeping your language simple and to the point.
Mhm.
Don't get too heavy into a lot of different language. You have to think about collaboration. And collaboration is really when you're working together so that you can come up with something that's mutual. What's going to benefit both people? That's going to make
Mhm.
everybody happy. But then you also have to
Right.
think about compromise. Compromise is really meeting someone halfway. So, for example, let's say you have you like everything about the job, but you just can't come together on the salary.
Mhm.
You're within $5,000, and I always tell people at the end of the year, don't squabble for
Right.
$5,000 because it's like $93 a week.
Mhm.
And $93 a week is a lot of money to some people, but when you're thinking about the larger picture, if the hours are great, if the location
Yeah.
is great,
Right.
the job itself something that you really want, you're going to squabble for $5,000. And what you do is you compromise and say, if we can't meet on this particular point, I would like to take the position, but what I would like to do is revisit this in 6 months. And then what you're doing is compromising so that they get what they want,
Mhm.
you're going to get what you want, and then you're going to meet halfway. And in 6 months or a year, whatever you decide on, you're going to initiate the meeting and say, at this point, I want to bring some data to you. As I was just explaining a few
Mhm.
minutes ago, here's the data of everything that I've done in the last 6 to 12 months. Can we revisit compensation? And now the compensation is not going to be that $5,000. That compensation is
Right.
up to 10 because now you then want to, come, a little bit halfway between that. You
Right.
also have to think about, I always tell people, keep your feelings out of it. Check your feelings, focus on the facts. This is business. Let's face it,
Absolutely.
this is business. And you really have to at some point decide, what are you willing to accept or not accept?
Mhm.
And
And
that's
so a
really what the bottom
BATNA,
line is going to be.
right. And so a BATNA is not necessarily, it's not a formal agreement. It's just basically like a framework where you're identifying all the possible alternatives, you're analyzing them, and you're really trying to figure out which one is the best for you, while also understanding that you're going to have to compromise and negotiate with the employer.
Exactly.
So,
And the way that you
yes.
do that is say, I'm open to discussion and exploring options that are going to benefit us both. Let's face it, each side wants what they want. But
Right.
when you come in, and this is, I think, a problem that many of us in our fields don't use enough, based
Mhm.
on my research, and then tell them what the research is. Based on my research,
Right.
salaries in this area are of a range from here to here. I
Right.
bring value to the practice. When you use I statements, it's confidence. What
Right.
experience or expertise do you have that's going to benefit them financially?
Mhm.
So, if you don't have something that's going to benefit them financially, they're going to say, there's not much we're going to do right here. But if you bring
Right.
some type of expertise to the practice, so for example, I had worked in GYN oncology and GYN surgery as a staff nurse. And when I
Mhm.
became a nurse practitioner, I decided that I liked women's health. I wanted to stay in women's health. And after a few years of doing just straight gynecology and menopause, I really wanted to really expand a little bit. And so I went into
Mhm.
primary care, and that was the value I brought to the practice. I was bringing gynecology experience because so many women wanted to have one clinician and they wanted
Right.
one stop shopping. They were postmenopausal, they weren't having babies anymore. They really wanted
Right.
to have one provider take care of everything. And that was my lever to help negotiate a better salary. And then the other thing is always saying too, is there any flexibility in the numbers?
Mhm.
Because again, counter offering, can help both sides get what they want, especially if you can't come to that particular agreement. And then you
Right.
say, if we can agree on this particular sticking point or whatever it is, then I'm ready to accept the position. I prefer, or if, let's say that you're already working there and this is maybe your 1 year review and
Mm-hmm.
can't come to the agreement. Again, that plan B would be, I would really prefer not to leave the practice. How can we come to a mutual agreement? So what it does is it puts the onus on them to say, I
Mm-hmm.
know that I'm bringing a lot to the table. I really like where I'm practicing right now, but what can we do to make it work for both of us? Because it demonstrates your commitment to the practice site and the
Right.
desire to continue with that particular employer, but it also leaves them wondering, well, maybe they have other options. So those are
Mm-hmm.
always things to think about.
Now, there is an I statement that I know is very negatively looked upon, especially when it comes to HR and you're negotiating contracts. And do you know what statement I'm about to say?
I think I do, but I'm not sure.
I need more money. So, how
Yeah.
can you reframe that statement? First of all, so it's not so negatively looked upon, but reframe it into those shared interests you're talking about, like retention and coverage and precepting and quality metrics. Because that statement, when you walk in there, I feel like it really they look at you and they kind of discredit you. I need more money.
When you use need or expect, it
Hmm.
comes off as negative. It comes off as,
Yes.
why is that my problem that you need more money? Yeah.
Because I work here. That's why.
Right, right. Because you work there. So let's face it,
Hmm.
we all could use some more money.
Right.
But it's always better to start the conversation with a neutral language. So I need more money puts people on the defense. I
Hmm.
am looking for opportunities to increase my income.
Hmm.
Sounds a little bit better than I need more money. Because
Does.
again, let's say, you have credit card debt. And I don't know, maybe you have a gambling problem. When you come in saying, I need more money, that is, again, the employer is going to say, that's not my issue. But when you come in to say, I am looking for higher compensation or I'm looking for ways to increase my compensation, can we have a conversation about that? Now that takes on a completely different tone. And it's a
Hmm.
much easier tone rather than saying, when you walk in, you're standing over somebody and say, I need this. Okay. But again, when you change the language, it makes it a little bit more respectful, but also
Right.
makes it a little bit more open to people having that conversation. Now, I've heard people go to physicians that I've worked for and said, I need to make more money. And the physician was like, okay, give me an idea of, what you're looking for and tell
Hmm.
me why you feel like you deserve that. And you need to back that up because the next thing they're going to say to you is, if I give you more money, aside from, cost of living raises or whatever it is that they
Right.
normally get, if you're looking for more compensation, you need to be prepared when you go into the conversation to say, here are all the reasons of why I deserve to get
Hmm.
compensation. And I always tell people, you need to prepare for an interview because you need to interview them like they're interviewing you. And you should always write things down. There's so many online resources that will help people who are looking to interview and give you better interviewing skills that will give you a
Hmm.
little more confidence. But I always say, bring in a pad of paper, keep the top page blank and write everything underneath, because you never know if somebody's sitting next to you and they can see like what your salary range might be, or maybe you broke down the
Right.
salary range into an hourly range. Maybe you have some of the compensation benefits that you would like to
Mhm.
negotiate. You always want to keep that top page blank so that you can write things down. And you don't ask permission to say, do you mind if I write things down? You always say, I'm
Right.
going to write some things down just so that the details don't get lost in our conversation. So
I'm gonna
again,
take some notes.
yes, how you frame it is going to be very
Mhm.
different, and received, as opposed to say, I need this, or you need to give me more money. That's going to
Right.
start off in a very bad situation, in a very negative way. But reframing the conversation is going to be much more well received.
Right. Now, I want to move us through this, just talk a little bit about compliance and ethics and things we need to watch out for so we can move into APRN specific information before we run out of time. But I wanted to ask about things to watch out for. Which bonus terms, clawback clauses, that is such a hard little statement there, should you question before you sign anything?
So yes, you never want to, first of all, you never want to sign anything until you've had at least 4 to 5 business days to review it and have a contract attorney looked at it. A contract attorney charges, depending on where you live, about $300 to $400 to review a contract. And you want somebody who's well versed in nursing and nurse practitioner roles. They need to know what the language is, and they need to know what the roles are all about and the scope of practice. So find somebody who's well versed in that. So you never ever want to sign on the dotted line until you've had time. And the way that you approach that is when they hand you the contract, you'll say, "I will get this back to you by such and such a date." You do not sign it right
Right.
here. And if they force you or really, really push you to sign it that day, you can just say, "I would like to have my attorney take a look at this to make sure that there's no language in here that doesn't belong in here, or language that I'm not currently happy with." So that's
Mhm.
one of the things. You always want to have a contract attorney. It is an investment in your future. Now, a clawback, in case people are not familiar with the clawback, a clawback is a contractual provision. And what it does is it allows an institution or an organization to actually take back money that was previously paid to people, whether it was a bonus or another particular, let's say it was one of those incentive bonuses that was something that was paid under like specific circumstances. It's
Mhm.
not standard practice, but it is a contractual obligation and it has to be agreed upon on both parties. So I would be very careful if the word clawback appears in your contract. I would question that. I'm not so sure I would take a job if the word clawback was in there, because let's say my productivity bonus was $60,000 and
Yeah.
5 months later, I've already spent that money or invested that money. And 5 months later, they say we need to have that money back. So
Hmm.
you have to look at that.
Absolutely. Now, one of the reservations I get is if somebody is wanting me to sign it within 24 hours, that's not really giving me much time to look at it, to look over it, to figure out what all the verbiage is. So it starts to make me a little leery of what they're trying to get me to sign on such a quick notice.
Right. And that's when they offer you a job after they interviewed you for 15 or 20 minutes. It's the
Right.
same thing. You don't know anything about them or enough about them to know that this is, the right place. So you always just say, "I will get this back to you by such and such a date. I would like to have my attorney take a look at this," and leave it at that. And if they say, "We need you to have this back in 24 hours," again, you want to question, do I really want to work here? Because if
Yeah.
they're going to push the issue on something like that, what's going to happen down the line? Are they going to say, "You can't go on vacation next week because we can't afford to have you out of the office"?
Right. That's something to
Or
think about.
we know we agreed on your hours, but as of next week, your hours are changing. So it
Hmm.
speaks volumes about whether or not they're going to respect your
Hmm.
ability to make a sound business decision.
Right. Now, pretty much everything that we've talked about thus far has been relevant to both RNs and APRNs, but I want to get to some APRN specific
Sure.
questions for you. My first one's going to be for APRNs, which compensation models should you ask about?
So there's a lot of different models out there. So one of them is a productivity. So productivity is a compensation model that can, and aside from getting your regular salary, you get a
Mhm.
productivity bonus depending on how much money you have brought into the practice, not how much you billed out,
Right.
but how much was actually collected. And what it is, it's based on RVUs. RVUs are relative value units. And Medicare, the physicians actually own this, the RVUs. They're the ones that came up with it. And every diagnosis has an RVU that's assigned to it. And so it really depends on what you're doing. If you are in a particular practice where it is very procedure driven, then you're going to have
Mhm.
higher RVUs, and that's going to increase your productivity. For new grads or those that are just getting back into practice after, let's say, taking some time off, strict productivity is not recommended because you have to build up your practice. And
Hmm.
you have to make sure that you have enough people that are coming back on a regular basis in order to have that productivity. So
That
salary is
makes
always
sense.
straight salary, base salary is always recommended for those new grads or those people who are coming back into practice and need time to build up their patient panel. Now, getting salary plus productivity is the best of both worlds because you get your straight salary and then it might be every quarter, it
Uh-huh.
could be half a year, it could be every 12 months. You'll get your productivity bonus. That is really the best scenario, but you have to make sure that you are getting your numbers. I hear horror stories all the time about practices that have two sets of books because they don't want the nurse practitioner to know how much money they're bringing into the practice. And so what they're doing is they're kind of being a little shady. And what they do
Ah,
is they give a little bit of a productivity bonus and they're keeping kind of the rest. So productivity
mhm.
bonuses can run the gamut. You can get anywhere from 5 to 33%. The highest is 33% of productivity, meaning you get a third, your employer gets a third, and then maybe the institution gets a third. It all depends on what their productivity model is. And that's the question that you have to ask is what model does that particular practice follow? Being,
Mhm.
again, a new grad or somebody just getting into practice, part of the productivity is going to be based on how many patients you conceivably can see safely. So, as a new grad, if they say, well, you're going to see 20 patients your first day, I would run because
That's
as a new
sanity check right there.
right there. And I think 20. No, not for a new grad, but if they say we would like you to see 8 to 10 a day for maybe the first 3 to 6 months and then we'll revisit it until you become more proficient, then that is completely appropriate. But if they want to
Right.
see 20 plus patients from day 1, they're all about the money and they're setting you up to fail.
Mhm. Are there any other sanity checks we should have besides the uh, typical amount of patients that you see?
So the patient thing is also a big thing, but other professional things that we need to think about are, and this is always a sticking point, is CME days. CME days should not be rolled into PTO, and it should be outside of like your
Right.
vacation time, your personal time, your sick time.
Right.
It is an expectation of the practice as both nurses and nurse practitioners that we are going to keep up with our continuing ed because that's going to benefit our practice and it's going to benefit our patients. So dedicated CME days outside of your PTO days is a must. And if
Mhm.
you're 5 days a week, then you get 5 days of CME and you should get CME funds to cover you. Other
Mhm.
things you need to think about are things like having your licenses paid for, your recertification, your DEA costs, which is, I think, $888 for 3 years. Those are the things
Yes.
that the practices should be paying for. I know the hospitals don't
Mhm.
pay for nurses' license, but certainly on the APRN level, because we need our RN licenses as well as our APRN license, the practices should be paying for that, and it should not be coming out of your CME money because again, you can't practice if you don't have your RN, your APRN
Mhm.
license, and your certification
Mhm.
as well. And then I think the last thing I want to, because I know we're running out low on time here, the last thing I want to make sure is that people have 4 hours of admin time. And that's important because otherwise you're going to be at home charting or on the weekend
Right.
charting, and those hours start to add up. And if you don't
I
have
do.
good time management skills, you need to work on that. Make sure that if you have a compute, an electronic health records, you develop your dot phrases, your templates.
Mhm.
If
Mhm.
you need voice activated dictation, learn how to use those things so that you're not charting after hours. I hear all the time people say, "Oh, I've got about 10 hours worth of charting, or I haven't charted in 3 months." I can't remember what I did 2 days ago, let alone 3 months ago. And it becomes a legal issue because if you have not
Mhm.
turned your notes in, they legally cannot bill out for that. So you're holding them up in terms of being able to bill, and then that in turn decreases your productivity.
Now, what questions do they need to ask about call?
So call is a dicey thing. It runs the gamut. I don't care where you go across the
Yeah.
country. There are people that don't get paid for call. There are people that do get paid for call. So you have to ask, is there compensation for being on call? I would say
Mhm.
probably 90% of the time they're going to say no. It's an expectation of the position. And then the next question you would ask is, how busy is call? So are you getting 10 calls in a weekend from Friday to Monday? I could deal with 10 calls and not get paid for it. Are you covering nursing homes, several nursing homes? Are you covering, inpatient where maybe you don't have a hospitalist and you're getting maybe 100 calls in a weekend? So you want to ask how many calls typically happen in the course of a weekend or overnight or whatever it is. And then the other thing is that you can always say if they're not compensating you, then keep your data. And then a year from now, when you sit down to do your annual review, you can say, when I was on call, here's the number of calls that I had gotten. This is how difficult they were or how detailed they were. And then try to revisit, the compensation for that. But taking call it really depends. Are you just triaging, or do you have to actually go into the office or into the hospital to see the patient? If you have to go into the office or into the hospital, then there should be some compensation for that. Because I will tell you, one of my very first jobs, the physicians used to take calls starting at 11 o'clock at night. We would have it up until 11 o'clock. And I would get a phone call at 5 of 11 from the hospital. I was still on call. I had to get dressed. I had to go to the hospital, even though it was 5 minutes before the physician was going to be going on.
They planned it out well, didn't they?
Yeah, they played it very well. But needless to say, that job did not last long.
No. Now, I want to talk about non-compete terms, because I know there are some areas where they actually have NPs who have a non-compete. So which non-compete terms are actually reasonable for you to question?
So non-compete clauses have to do with the fact if you decide you're going to leave a practice, they can state in your contract that means you cannot practice within anywhere, let's say 20 to 60 miles for 2 to 3 years. Now, many people are able to negotiate that out of their contract. A lot of places will not allow you to negotiate that out because they're afraid you're going to move across the street and there goes all of the numbers. And they can actually sue you for loss of perceived income. So you want to
That's important to know there.
Loss of perceived income. And I will tell you that I knew a physician that had quit working in an office. It was an office we had both worked in. And she went to go work for Doctors Without Borders. She came back. There was a physician who was a solo physician who had to go out on a medical leave. And this doc said, I'll come in and, pitch it for you for however long it takes you to be out on surgical leave. And the doc went after her. And he said she was in breach of her non-compete clause. He lost because the judge actually said, really, they're not doing it to go to work. They're helping somebody who's out with a medical issue.
Right.
It was thrown out of court. But you just don't know. And so a lot of nurse practitioners choose not to sign a non-compete clause, especially with health systems that are taking over practically the entire state. So in my tiny little state of Connecticut, we have 2 huge health systems. We're either Yale or Hartford. We have offices all over Connecticut, Rhode Island, and Massachusetts, New York. I would have to drive to Massachusetts in order to get out of my non-compete clause because the non-compete clause states that it's 30 miles from the closest facility. So if my closest facility might be in Enfield, I'd have to drive to Boston to go to work in order to go away from that close facility to where I want to go work. So you can choose to negotiate that out, but again, it's not always feasible.
That is definitely something that you need to be looking at before you sign any type of contract.
Exactly.
Because the wording that they use for those non-competes can be very tricky.
And that's why you need to hire a contract attorney so that they can look at it.
Yes. And it's not just APRNs that end up with non-competes. I mean, there are times where nurses will end up with non-competes.
It's a little bit less common with RN positions, although like you said, it is becoming a little bit more frequent, but I don't see it nearly as much as I do with APRN. So I want to just tell you a quick story. So when I was working at this other practice, I had been there for almost 13 years and I really needed to get out. And I interviewed for the practice that I'm at now. And the doc had offered me the position. I had gone in, done some shadowing, and we'd known each other within the community. And I said to him, I have a non-compete clause. And he said, I'm not worried about that. Our attorneys will take care of it. Make me feel so much better. I go home, I pulled my contract out. I had the original contract and the doc never signed it. And I thought, this can't be happening. So I ran downstairs. I said to my husband, just look at this. Please tell me that his signature is not on here. He said
Right.
it's not on here. So I immediately called my attorney and I said, he never signed it. I have the original copy. And then why do I know I had the original copy? Because legal documents have to be signed in blue ink.
Yes.
Yes. So that's the only reason why I knew I had the original contract. And he said, he can't hold you to it because you have the original contract. It doesn't matter if he signed the copy, you have the original. So always, and I never even thought about it. I had worked there for so many years. I never even thought to look
Yeah.
at my contract. He just handed it back to me and I stuck it in a file. And that was the only reason why I literally moved 3 miles down the road and he couldn't do anything about it. And all my kids were
Wow.
yeah. So
That
you
was
never
a
know.
blessing right there. That was huge. And, as we see a lot of healthcare jobs move into telehealth jobs, you are starting to see some
Right.
non-competes within those telehealth jobs. So, I just want to point out to our listeners, if that is something you are looking into for a telehealth job, make sure you read the contracts because there are some who come back with, especially in education, they come back with non-compete.
Exactly.
Mm-hmm. Well, Vanessa, you have unpacked so much stuff, and I'm going to have to listen to this again just so that I can take notes so that if I'm ever in the market for another job, I know the right questions to ask and how to really put my value out there. So thank you so much
You're
for
so
being here
welcome.
with us.
Thank you. I
Now,
just want to leave your listeners with one or two little things. Remember
yes,
to pose yourself as an asset. It's so important that they know how important you are. But remember that you can't get what you want if you don't know what you want. So you have to do your homework when you are going for a job interview.
absolutely. Think about that clarifying question that, you can ask about that position, the pay band. See if you can pair it with some different levers that we talked about,
Right.
schedule, differentials, professional development. And if you're a leader, I really just challenge you to pick one pre-approved lever that you can offer without having to have a committee meeting, so that you can show your staff that they have value to you. I think that would be really good. And
Right.
then APRNs. Try starting your next conversation talking about the realistic value unit targets and what makes that realistic. First of all, you need to decide what's going to make that realistic for you before you ever walk in to negotiate. Would you say that that's correct?
Exactly. You have to know your value before you walk in anywhere. And again, if you don't sell yourself, then they're going to
Nobody else will.
nobody else is going to do it for you. You have to be. We are our
Right.
patients' best advocates.
Yes.
We need to advocate for ourselves within our positions. And you know what? We deserve it.
Yeah, you're right. And I just thank you, Vanessa, again, for just being here because you have shared so much insight into nursing pay. I mean,
Thank you.
overall, I learned so much. So I'm just so grateful. But to our listeners, I encourage you to explore many of the courses that we have available on elitelearning.com to help you continue to grow in your careers and earn CEs. And in the spirit of this episode, I leave us with may your ranges be transparent, your differentials generous, and your contracts clawback free.
Wonderful. Thank you.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.